Everyone, I'm Andrea Matthews. I am the founder of Children's Sickle Cell Foundation, and we're happy to have you guys all here on this cold January in 2026. It's our first meeting of the year, but we have been since our hiatus for November, December. So we're happy to be back, and we are talking about OVR employment and SS. I and SSD work incentives. We're going to put our names in the chat box, and then we're going to have some case presentations. So the purpose of this presentation is about choice, support, and safety. Many warriors with disabilities, which sickle cell disease falls under the disabilities umbrella, want to work more, and they want to have more options. A lot of folks live in fear of losing their benefits, their health coverage, and stability. And Pennsylvania's Employment First Act makes it clear that competitive integrated employment should be considered first, but never forced. Today, we'll talk through three practical systems: the Office of Vocational Rehabilitation, OVR, Ticket to Work, and the WIPA benefits that allow patients to explore employment at their own pace and discuss with their clinicians how they can obtain letters. And when those letters are written with functional clarity, they can open doors rather than close them. And our goal here is to have this conversation so that, well, your community health workers, and if you work with patients directly, is to ensure that you are knowledgeable about these programs and that the conversations are patient-led, medically informed, and beneficial and safe for the warriors. Community health workers work as trusted guides to this information, and we rely on the information that we receive from these programs to keep us up to date. So, common warrior concerns. Oh, by the way, I'm going to use the word warrior instead of patient, but sometimes you'll see patient in the language that we use. Those are being used interchangeably, meaning someone with lived experience with sickle cell disease. But some common warrior concerns are that, basically losing the benefits or losing Medicaid once they get a job that has paying benefits. Sometimes they want to work, but they're not able to do it full time. They sometimes are a little bit apprehensive about getting into work because they don't want to lose their SSI benefit, or they don't want to lose, start working and become sick and think that they will lose their benefits. And how do I use accommodations for flexible work? How do I have that conversation? And do I have to? Am I being forced to work? The key messaging here is that exploring work is voluntary, it must be supported, and it is protected under PA law. The Pennsylvania Employment First Act, what it means, Governor Wolf, he's about quite a few years now, instituted this, and this is one of those laws that really, if you know the law, you're able to share this with the families and give them a little bit more comfort in seeking employment. So competitive integrated employment is the preferred first outcome for people with disabilities. We want you to be able to work, and one of the things that comes up a lot is how much it helps people with sickle cell or any disease or disability to be in the workforce, to have a place to go every day. It's really helpful for your mental wellness to have a place of employment where you're earning and that is respectful of your contributions in the workplace, and also support you when you need to be away from the workplace. Employment, people with disabilities have the right to work in typical common jobs or community jobs. They are everywhere, right? In every aspect of life, we have people who are working and that may be living with sickle cell, but that employment must be person-centered and voluntary. The one thing that keeps coming up is, selecting the right job, helping those who are transitioning from the pediatric care center to the adult center will typically say, I'm still exploring my options of where I want to work. But if they're also receiving SSI, they need to make those decisions that will continue to have to where they're able to get their supports, but also get a high paying job enough to where even if those benefits are not there, that they would be in a position of having a living wage and benefits that would help them maintain employment and maintain a level of self-sufficiency. Sometimes that's not always possible. And employment first does not mean everyone must work. So just making sure that that's a good distinction. What it means for sickle cell warriors is that warriors have the right to explore work, to match their role, health, and capacity. And it should be something that it could be part-time, it could be full-time and flexible, but it must be supported employment. Choosing not to work or stop working is allowed. It's not punitive if you're not able to work. But again, putting employment first in the opportunity. So it's important. All right. So the Pennsylvania Office of Vocational Rehabilitation, I know you guys on the call know a ton about this, probably more than me. But I wanted to make sure that we include all of the services that they provide, and then how we interact with OVR is very much in line with allowing them to do what they do, and then also because this is a free service that they can start while they're still in high school. If they are 18, they turn 18, they can use their school as a place where they can connect with OVR. They also can use the community-based organization, connect those who are eligible for OVR to those services that you see on your screen. The cost is free, and they do support with assistive technology accommodations, training, and there's a lot of supports that can be found with the Office of Vocational Rehabilitation. We like to connect with them when we can. Their caseload is insane. So if you're going to work with somebody who needs OVR, please help tell them to get on the road quickly and stay connected to them, because it is an interactive process. And once they start with them, they should continue through the process and receive as much help as they can, because they do have a very large caseload. Step by step, there's an online application, or by phone. You can refer yourself. As a warrior, they can refer themselves, or they can go to their school counselors, or even go to a community-based organization like CSCF or any other community-based organization in the state. There is some eligibility, and so there may be the need to have your physician write for you to verify that you do have sickle cell disease. And then if you already have an IEP and you qualify for an IEP, that automatically qualifies you for OVR. And so here we see the word patient. I would really change that to warrior, but that was one that I told you would, and I couldn't get them all. But they can bring a community health worker, caregiver, advocate with them. This is one of the key roles that a community health worker can really help with, helping to navigate and be a part of this process of obtaining OVR resources. Ticket to work. Ticket to work is for people 18 to 64 receiving SSI or SSDI. This allows patients or warriors to try working without immediate loss of benefits. It's amazing because it used to be that once they started working, within 1 to 2 paychecks, their benefits were ceased, they were stopped. And this connects them to approved employment service providers and removes this medical continuing disability reviews. So while you're using the program, so what a continuing disability review is that they would every year they have to recertify. So if they're in the program, then they don't need to do that. So how Ticket to Work works. The patient receives a ticket automatically from the SSA, Social Security Administration, and this ticket is assigned to the employment network, or the state agency like OVR, Vocational Rehabilitation Agency, and then they work toward their employment goals. So it would be wonderful if we were able to become one of these agencies and help our families. But at this time, that is not something that we have explored. So there are other agencies like the Brashear Association that helps people with employment. That could be an opportunity to be one of these agencies. And this also causes the medical reviews during active participation. This ticket use is voluntary, so anything that we're talking about today is all voluntary. You don't have to work, but if you have the desire to work and you want to, your warrior wants to improve their quality of life, they're able to take advantage of these.
And Dre, I have a question.
Yes.
The Ticket to Work program, have you experienced any situations where it's kind of messed up someone who was already on Social Security, where it's kind of backfired and negatively affected their Social Security benefit?
I have not had that experience, and I've not heard of anyone having that experience. These programs are to work alongside the benefits until that person gets to a place where their compensation they're more self-sustaining, meaning that they have medical benefits through their employer, or health and medical benefits through their employer. And even then, the Medicaid part will still be the backup. So where if you have primary insurance through your employer, then that will stay in place. But then you would also have Medicaid that would be the secondary insurance. It would become secondary. So that would decrease the burden on the Medicaid system. And so this is why this is a good thing for them to keep both, allow you to be in that system for a longer period of time and not have any punitive activity, events.
All right, thank you.
And as the income is changing, this particular program, the Work Incentives Planning and Assistance Program, they talk about how work affects your SSI. At what point would you become, would you not receive benefits anymore? And then they also have housing and other benefits. So this is really for folks who are thinking about working, who want to explore their opportunities to work. The mental health benefits of working and going to work and earning money and becoming self-sufficient. It decreases stress. It helps people, with their just their overall self-perception. And this is why this is really important, because if your self-perception is higher and you're less stressed, then you may have less crisis. That's not a proven thing. There's no data out there that I know of yet. And I'm sure, because I just haven't seen it, it's probably out there. But the goal is really to get people into a space where they feel good about themselves, about their capacity to work, and right size whatever work situation they're going to be able to do based on their capacity. Okay. SSA is going to be your first line again to getting this information. So the Ticket to Work helpline, get referred to an agency, and then meet with a certified benefits counselor. This information is really critical for our community health workers who are working with our families, because this is the information you need when someone says, hey, I'm thinking about going to work, or I would like to work. This is a pathway for them to work and explore the work options without losing their SSI. And then they're going to receive their benefit and summary plan. And then you want to have them refer and go through the process before they start work. Working in employment is it can be very difficult if they're not armed with information.
Right.
how they all work together. And this is something for the community health workers to really think about, having this information in their minds as they're working with someone who says, hey, I'm thinking about, I'm leaving high school, I want to work, I don't really want to go to school, I want to jump right into the job market. First question I'd say is, have you talked to OVR at your school? Have you talked to your counselor? And then see if that, is something. But if they're already receiving SSI or SSDI, you want to make sure that SSI is that they apply for Ticket to Work so they can go through both of these programs. And all three work together to provide the safe, informed path to employment, whether they're leaving high school and going to, right into the workforce, or whether they've even been in the workforce for a while and have had some setbacks, right? Sometimes people are at work and they, we just talked to a person who lost 3 jobs because they couldn't stay at work and come to work a lot. And so one of the things that keeps coming to mind is, this person obviously wants to work. Let's get them to this program so we can see, one, if they're already on SSI and they're collecting, a small amount of money, but it's not enough to sustain themselves, and they have the desire to work and they're able to work, let's get them to that safe path to employment. So clinicians, I know we don't have any, well, we do, ladies on the line. So there are, this is very important. Clinician letters can support OVR eligibility. They can justify the accommodations that are needed. They can reduce unnecessary denials and protect patients from being misunderstood. It's very, very important. That's why I read each one of them to you. I know you can read, but only if the letter is written clearly and functionally. It's really important that there are some helpful things that they focus on function and not just the diagnosis. We understand that fatigue is a big issue with with warriors, and so specifically being as specific as they can without going over, into the doom and gloom. We'll see that in the next slide. They need to, avoid language about life expectancy or total capacity, unless these things are a factor and true. Here's some key elements, some things that we would expect. And then these recommend, I'm sorry, gotta go back. Recommending accommodations is extremely important because it's going to help formulate, length of time that the person can be sitting or standing or lifting, pushing, pulling. And then the tone needs to be clear, factual, and supportive of them working so that the employer isn't turned off by the letter. Some helpful things, phrases that they can use that, patient can, they will probably say patient because they're coming from a clinician space. Patient at work part-time with flexible scheduling. Well, that might not work for every job, so it's really helpful to know. But if they're able to do a part-time flexible work atmosphere, then that will be great. And it's helpful to know, to share with the warrior that not every job is going to be able to do that. So even though you may want that job at, Target, and they may not be able to do and accommodate all of these things, it doesn't mean that Target's bad. I'm not using Target as, I don't even have any examples about Target specifically. So I'm just using that first thing that came to my mind. But even if they are not able to do it, doesn't mean that that employer's the wrong, is that they're wrong, or that they should give you a job anyway. It just means that they can't make that accommodation. It's not the job for you. Some people need remote or low physical exertion roles or medically appropriate. That statement there is very important to be able to communicate. If the job is on site and it says that you have to be on site, don't apply for that job. I mean, it's just really simple. If you need a remote job or something that's low physical exertion, you're going to need to be very selective. And these conversations, and this is why community health workers are like really important, to have that empathy in the way that you deliver these messages. But these are, the things that we want to see in the clinician letter. A lot of times patients will not see the physician letter. Sometimes they share it. And sometimes it's very hard to read the clinician letter because it says some things about you as a warrior that you would maybe not want shared in that very way. So what they should avoid writing. It's wonderful to tell them what they should write and some helpful phrases, but let's talk about what they should avoid writing. Patient is permanently unable to work. Unless this is absolutely true, that's probably not a helpful statement. And it's not helpful because the person's seeking employment. So if they're permanently not able to work, then, why are you writing that? Speculation on any SSA decisions, that should never be a part of it. Life expectancy statements, and then overly vague statements like is disabled or very sick. All right. I think we just okay, this is what I need. I'm sorry, there's a typo on there. So how CHWs and staff can support warriors. Normalize fear about working, because there's going to be some apprehension especially if they've never worked. Some of the people that we have hired, even with Children's Sickle Cell Foundation, and of course we've hired, hired and trained about 40 people in the state, across the state to work in sickle cell. So I'm not speaking out of turn here. Some people have said, this is my first job. This is my job. This is I've never worked anywhere, even though they were clearly an adult. Just getting to work was kind of tough. And but the joy on the back end, if we didn't give them the opportunity to work and come out and interact and do all these things, they would not have received all the joy it feels to really help somebody else and to work and to come to a job, even if it was 5 hours or 8 hours a day. But refer them to the programs, encourage OVR as a support, but we do not want to pressure people into having to work, but we want to highlight the amazing benefits to going to a job and becoming self-sufficient and not having to live with a sibling or a parent or a loved one, or feeling that you have to live with someone else because your income does not support you to be self-sufficient. CHWs can help gather documents and enforce patient choice and pacing. Again, if you have never worked and you find yourself in that, you have a client or a warrior that you're working with that is in their 30s and they've never worked before, giving them some helpful tips on getting a part-time job, starting small, working through transportation issues, and providing supports for them to get to and from. And then you might even have to refer them to a budgeting class because they've never had to work in their budget. They've only received what they received and then they spent it however they did. But now that they have much more money, they need help in planning, maybe for their bus pass or planning for Lyft rides or however they're going to get to work. Okay, key takeaways to share with families and warriors and families. You don't have to choose between work and healthcare. These are free programs. If anybody tries to charge you for this, it's a scam, and that's really, really important. One of the things that once you sign up for some of the programs, there are hackers out there who would like to send you information, and always go to the correct websites. These free programs exist to support you. The counseling protects your benefits and helps you extend the time that you are able to work and receive benefits. Your health comes first, and work is an option, not an obligation. It's really important that we continue to share that information. So, that's it. And so, also, the next steps for the CHW will be to build this referral list. Anybody who may be needs to be referred. Use functional letters. Encourage your clinicians to use functional language in letters, and then warrior families to schedule their counseling with WIPA and OVR before they start working, and then integrate employment supports into the care planning. So you guys are all doing unified care plans. I think that employment support should be a key part of that. And then we're going to hear from Ty a little bit, just talk about your experience working with families, helping them get employment, and then open it up to the rest of you guys. I'm going to stop sharing there to have that conversation. So questions, for Todd, you want to share? We can open it up.
Yes, hello everyone. So I know here at CSCF working very closely with a lot of our adult population and working with our pediatric population. We deal a lot with our children transitioning into adulthood, not knowing, if they want to go to work, not knowing if they want to pursue college. So we have to have um, these options in place for them. I just want to give a example of a child transitioning from out of high school, possibly um, going to work, and then I'll give a example of how we handle our adults who are transitioning, whether they lost the job or whether they are just trying to figure out what they want to do based off of getting Social Security and how that works. So. An example for one of our children who is coming out of school, a lot of times the barriers are, well, I want to go to work, but how am I going to pay for my bills? How am I going to get there? A huge barrier is transportation, not knowing how they're going to get there when they've relied so heavily on whether it's the school bus or their parents taking them, or public transportation. At our organization, we do partner with an ETAP program that provides them direct connections to be able to get to work. And then we work closely with them under their unified care plan to ensure that the first phase of the unified care plan is completed with their demographics. And then the second part of the unified care plan that we do really drills down on what their goal setting plans are. So we know that we can go out and we can get a job, but these barriers that are sometimes in place that we here have dealt directly with is maybe they don't have an outfit for a job. Maybe they don't have good interviewing skills. So we have to be able to provide these types of services to them. And I believe that is where the direct connection with the other partners that we partner with, whether it's Brashear, whether it's Ebenezer Church that we are partnered here with, and they are the extended arms to the supports that we need to help. I would say our children who are leaving high school going into college, trying to give them the resources that they need to have a successful interview, successful speaking skills, and the tools that they need. Now, if we move to adults wanting employment, adults gets a little bit tricky because adults want jobs, but then we have to worry about their lifestyle, what they're already living in. Do they have kids? Who's going to watch their kids? How would they get to their interview? And how do they get the supports that they need? So it's very beneficial for any community-based organization to have the additional resources that they need to support an adult if you don't have that in-house. One of our families, she didn't have anything to wear. I had to send a community health worker out to support her in the community to give her funds to be able to go get something to wear for the interview. But leading up to that, we have to ensure that we're just not giving, that they're taking the proper steps to do what they need to do to be able to receive those types of supports, like ensuring that they're registered, ensuring that they're fulfilling whatever the goal is for them to receive the job. We just can't, give them, supports to go out and get an outfit, and never follow up with them to see if they did go to that interview. So it's very much the connection is that you have to be one-on-one with these parent people and be transparent with them. I think that's pretty much it.
Thank you. Does anyone else have any uh, experience working with warriors who are seeking employment? Do you want to share?
Yes, this is excellent information. I look forward to getting the slides. But one of the things that I wanted to say is that also establishing a rapport with the specific people at OVR so that, you can, when they go, they can use that person's name. They can say we referred them. And that has been very helpful. So they're not just walking into a space and not knowing how to navigate it, but having a contact person or persons. And if something doesn't go well during their time of interacting, we can always follow up to find out what were some of the challenges that occurred and how can we assist, or talk to them. So that's very good. And in terms of companies that would employ someone that has sickle cell disease, if it's, like we do a lot of community outreach. And so maybe we get a call from a corporation or an insurance company that they're having a health fair event. So we set up a table there with information about sickle cell disease, but it also becomes an opportunity to speak with management at that company to be able to say to them, would you consider hiring someone that has sickle cell disease? Certainly after they've been educated through the information that we provided. So that's another way of connecting with different companies that have health fairs where you can talk directly to management there. So that's just a helpful tip that I wanted to share.
Thank you. That was great. Definitely, definitely. And yes, I can email the slides out on the profile. All the slides will also be available going forward, so everyone can download themselves when you need them. So you don't have to worry about getting an email, but I will email them out to you.
Is there a link to be able to access them on the website?
Yeah, when you so in the iEcho, once this ends, the video, this presentation plus the slides will be available inside of iEcho, and that's for any of the iEchos that we've done. So they're all there, and this one, once the recording is finished doing what it does at the end of the Zoom, then we upload that as well. So you can redo that. You can take a look at that and download the slides, but I'll definitely send them to you via email. So don't worry.
Right. I also wanted to mention in reference to people not having an outfit for an interview, we've established a partnership with an organization called Our Closet, and they have all new items. And so no matter when we call, whatever is needed, someone will be able to get, and they will deliver to them as well. They deliver. So like we have families. We have families that may be in need of clothing for school. And if we send like the sizes and all of that to them, our contact there, they will put it all together and then ship it out to that person at their home address.
Wow. So is that only in Philadelphia?
As far as I know.
Okay. So for in Pittsburgh, in this part of the town.
Andrea, we have such a we have a relationship with an organization called Dress for Success.
Okay.
Here in Pittsburgh. So, and I think it's pretty much built more or less around obtaining a job. So, they have business attire, whether it be shirts and slacks and appropriate shoes, things like that. So we do have probably an agency sort of like what Zamora is mentioning. So it's just really a matter of us making sure first and foremost that the family is comfortable enough with you to share that they want to work, but they don't necessarily feel equipped or prepared to work. So, and the other thing I wanted to say is the state, in my experience, the state has been highly responsive to supporting endeavors to help individuals get work. So, calling our program officer and saying, hey, this person really wants to work, but this is something that's not normal. But they have always been supportive in providing the necessary tools and funding to help a young person or an older person with sickle cell obtain employment. I've always had good experiences with whether it be Dana or someone else from the state. They've always been very supportive.
Mm-hmm. And also inviting those organizations to any event that you might be having.
Right.
Like, for example, we have our sickle cell 5K walk and run, and we have a variety of vendors that can come and set up. So that's another way of making a personal connection and letting them know, we would love to use your services moving forward for employment or whatever it might be.
Right.
So something that Ty mentioned was the ETAP program. That is through Travelers Aid, and I believe that you might have one in your area, Zamoria,
Yes.
the Travelers Aid, and so that employment transportation assistance program, ETAP, may be something that you might want to look into if you don't already have that connection.
No, we don't.
They provide discount bus passes. They're normally $98. They provide them at $31. So it's steeply discounted for the monthly bus pass.
Okay.
And so that one was one of the things that has been almost a year. CSDF has been using that program. And it's completely filled right now.
And with Philadelphia having such a massive transportation system as opposed to Pittsburgh.
Yeah, they actually have a location set up in our train station, 30th Street train station, and they have a stand right in there. So that's a good resource. I'll definitely look into that.
Great.
Travelers Aid. They've been around forever.
Yes. Yeah, they've been around for a while. And they have 3 different programs that they offer, but this is just one of them that they have. So any questions, comments, concerns? I really want to be respectful of everyone's time. We did move quickly through the slides, but if there's no questions, I'm going to go to the final slide about the next topic. I just make it. So questions open for anyone. Okay. So the next session is going to be, and this is my back end to the ecosystem. So I'll just share with you. This is advocacy and practice, reducing bias and improving experience in EDs and clinics. This is one of the Pennsylvania topics that we talked, through our PASCPN. If you're already signed up in iEcho, you will be listed here. These are the participants that receive all of, and just to share with you guys, since you're kind of the core group, these are all the folks that receive that email, and they're invited. They signed up for it, and they'll receive an email about a half an hour before. But then we have some other topics coming up in March is the emergency department and patient support. And then where you would download from is right here. I'll show you this more. We started here. Let's go to we're here. You would just go, I'm going to upload any content, and once the content's uploaded, then you'll be able to download it in the participant. This is how it would look. You would be able to go over to any of the find the session and then download any of the information. Okay.
These are the upcoming sessions, right?
Yeah, those are for another echo that I'm in, but these are the upcoming sessions. On 27th, it's reducing bias and improving the experience. I'm going to hopefully Camille's going to be able to give us some information on that, and then you should be able to see the entire group of sessions when you log into your iEcho. You're just going to go to iecho.org/home, and you should be able to get to your own sessions.
And Andrea, that is the 4th Friday of every month.
The 4th Friday of every month from 12 until 1, or like today, we're getting done a little bit sooner, but we very rarely go beyond 1 o'clock. So we try to make sure that we're finished before the lunch hour is over. So it's kind of a lunch and learn, but we're really excited about the Living Well Sickle Cell Project Echo for Pennsylvania. And if you have a topic that you would like to see us cover that's not on the slate yet, we will be going into an additional year, and we have some summer programs, summer sessions that have not had topics. One of my favorite ones that I don't have a speaker yet for, that I want to bring to light is medical advocacy, and our conversation around what we're doing to address stigma in the hospital system overall, not just in the ED. So medical advocacy is extremely important, and we've been doing a small pilot with Elite Medical Consulting and providing medical professionals to help our families advocate better for themselves at the time of crisis and during hospital stays. So more to come on that. Really excited about it. And we have a team of about 7 medical professionals who are on call, basically, not getting paid on call, but on call for to advocate medically for our families and to interface with the hospital. So we're really excited about that. And it does make a difference when they have different eyes, different perspectives. And when we're in crisis, we sometimes don't ask the questions that need to be asked, so we don't get the care that we deserve. So more to come on medical advocacy. Once I have someone to talk about it and to go over it, we are working together with the University of Pittsburgh Adult Sickle Cell Program, their social worker, and also the University of Pittsburgh Center for Race and Social Problems. That is going to be, it's a 3-way partnership on this project. So more to come on that. And thank you so much for your time today. I'm going to give you 15 minutes back. So thank you. Stay warm, stay safe.
Oh, yes.
And we'll be praying that this storm just passes all right out to sea.
Yes. But I wanted to say thank you. I know it's hard every 4th Friday putting something together, but also you want to make sure you have the people that can really hear the information. So I'm glad that, this popped up and I was like, oh, is this the last Friday? But then I saw it and my schedule was pretty clear around this time. So I'm glad that I was on. It was very helpful from you, Andrea, and Ty. Really appreciate all the effort that you put forth to bring something that is meaningful and informative. So thank you.
Thank you. And thank you for joining in when you can. So, and there's no limit if you have your community health workers that want to join in. It's not an exclusive group. We're here to learn, and I'm sure we learned from you today. So we learn from each other, and it makes us stronger. So thanks so much.
I just want to say this is your son right here, Jonathan. Yes. Are you in the mountains or where are you? This background is amazing.
I'm not too sure, actually. I just teleported here today.
Down the hall.
He's down the hall.
Okay. Oh, I love the background. It's amazing.
Thank you.
All right.
Okay.
Take care, guys.
All right. Take care, everybody. Take care, Mike.
Have a wonderful day.
Okay, you too.